everyone. So it is Tuesday afternoon and I am stuck in a little bit of traffic going back to my parents from my doctor's appointment, but wanted to take this opportunity to do a video for today. And since I just had a doctor's appointment, it seemed like it would make sense to have this video focus a little bit on my health background, my medical illness, chronic disease stuff. I feel like that is about the worst explanation or description, but anyway. So I'm gonna do kind of an overview of what my major health issues have been, and then I'm gonna do a separate video when I have a chance to really sit down and speak a little bit more in detail about my kind of history and background. So my main diagnosis, I don't know if I would say main, actually, my kind of umbrella diagnosis, I guess, kind of the one that everything else seems to be related to, is chronic Lyme disease. And I was diagnosed with it when I was 15. I have most likely had it since I was younger. We think maybe around when I was 8 or something like that, based on just some things that people remember and stuff like that. It seems like maybe 8 was when I was first infected. When I was 15, I was definitely reinfected, if I was indeed already infected before that. And then, so I was diagnosed when I was 15, and things kind of progressed on from there, and I eventually got all of my other diagnoses from there. Sorry, this is shaky, guys. I'm in the car. This is not, I don't like doing car videos, but right now this is kind of my chance to record one. So I'm just gonna do the best I can. So 15, diagnosed with Lyme, and then when I was, I think it was maybe 4 years later, I started getting some more testing done, getting some other diagnoses, seeing some better doctors, and was diagnosed with 2 other tick-borne diseases. If you don't know what Lyme disease is, by the way, I will speak a little bit more about that in a minute, and I will put some links down below so that you can learn more about it. So I was diagnosed with 2 other tick-borne diseases. One is called babesiosis, and the other one is Bartonella. Babesiosis is a protozoal infection that is similar to malaria. So it's not. It can cause like fevers and stuff like that. I was not having those particular symptoms, but I have at times had those kinds of symptoms. And Bartonella is caused, the strain that I had, maybe still have, is the same bacteria that causes cat scratch fever. But when you get it from the bite of a tick, it tends to go more into your neurological system and cause kind of a different set of symptoms. So those are my 3 kind of, those are my 3 tick-borne illnesses that I have been diagnosed with. The Lyme and the Babesia initially were made by clinical diagnosis. I have since then had positive testing for both of those. The Bartonella has always been based on positive testing. Then after that, not too long after that, I think, I was officially diagnosed with a type of dysautonomia. Dysautonomia is when your autonomic nervous system does not work correctly, and in my case, that is likely to be caused by some nerve damage that the Lyme has caused to what's called the vagus nerve. I didn't really think all of this through, and I feel like I'm using names of things that I should maybe be a little more general and broad, but anyway, so the vagus nerve that kind of controls your whole autonomic nervous system. So your heart rate, your blood pressure, your respiration, your gastrointestinal tract, your digestion, all of that is the vagus nerve is involved in that. So for me, it caused some low blood pressure, high heart rate, dizziness, fatigue, lightheadedness, almost passing out. I never actually blacked out, but I came awfully close a number of times, and I had a test done that kind of tried to push me into being in that state by keeping me upright and standing up for a prolonged period of time, strapped down to this table. It was not a pleasant test, but anyway, and they are taking your blood pressure and they're taking your pulse and all of that, and my blood pressure dropped incredibly low, and I got really sick, and so I was officially diagnosed with that. And my type of dysautonomia is neurocardiogenic hypotension, or it could also be neurocardiogenic syncope, but I don't actually pass out, I just get low blood pressure. So for me it's technically not syncope, because syncope is passing out. And then a few years later I got the diagnosis of gastroparesis, which is basically your GI tract. It's related to the vagus nerve. It basically means that your GI tract does not digest food well, it does not move things along properly, there's not good kind of coordination and muscle movement to digest the food and get it moved through your GI tract well. So there was a stretch of time for, I don't even remember how long, 4 or 5 months maybe, when I was hardly able to eat anything, lost an insane amount of weight, almost ended up going on intravenous nutrition, but my insurance wouldn't approve it, so I didn't end up being able to do that. But finally got the diagnosis, started on treatment, and slowly was able to kind of rebuild things. So those are my main diagnoses. The Lyme is believed to have pretty much caused or contributed to everything else. I may have already been predisposed to the dysautonomia and the gastroparesis, and the Lyme just kind of pushed that and triggered that to become more of a problem. My treatment for this has been kind of extensive over the last, since I was 15, over the last 17 plus years. I have been on lots and lots and lots and lots of antibiotics for the tick-borne diseases, both oral and IV. For a short time I was on intramuscular shots of antibiotics. That was not fun. I did not like that. I have had now 4 portacaths in my chest, at different times obviously, but I'm on my 4th port. I have had 3 PICC lines, I think, which are similar, semi-permanent IV lines, and those are in your arms. I've had those like when ports have failed or whatever, and I've needed more temporary, quick access to do treatment. So there's been kind of a lot of medical stuff involved in that, and I will again do a video that details a little bit more of that. For the dysautonomia, I have tried various medications, and nothing really has helped in my particular case. So my main treatment for it has been doing IV fluids. So I do IV saline infusions. Thankfully, at this point, I do not rely on them nearly as much as I used to. I used to need 1 to 2 liters of fluid a day. At this point, I can get away with pretty much not getting any IV fluid. It helps me to get it at least periodically here and there, but I can function much better than I used to be able to without it. For me, being pregnant kind of seemed to fix that to some extent, which is amazing and doesn't happen for everyone, but I was lucky that seemed to happen for me. And then for the gastroparesis, I am no longer on treatment for that, but I was treated with some medications to help kind of get my GI tract moving a little bit more efficiently, along with anti-nausea meds and all kinds of stuff to kind of help the symptoms of that. I am now over 17 years out from my initial diagnosis of Lyme. And I cannot even say how much better I am now than I have been in the past. I am not necessarily, so when I was first diagnosed, I was not super sick, but over the course of the following probably 10 or so years, there were periods of time when I was very sick. So I am now at a point in my life that I didn't always think was gonna be possible, where I am married, I have a kid, I am actually now, as of my doctor's appointment today, taking a break from treatment. So I am stopping the antibiotics that I have been on. I have been on antibiotics continuously since just before I got pregnant with Lex. So almost 3 years of continuous antibiotics, and usually I have breaks here and there. So this is very nice to be able to get a break and to have a very positive appointment with my doctor where we're so happy with how I'm doing, and very just like amazed at how far I've come. I've been seeing my particular doctor who specializes in Lyme and Tick-Borne diseases and stuff like that. I've been seeing her for almost 11 years, which we figured out at my appointment today, and she says that I'm probably the patient she's treated the longest. But the fact that I have overall just, made progress, there have certainly been steps backwards, but like the progress that I have made has been kind of amazing. It's remarkable to look back and remember the times when I was super sick. So this all stems initially from Lyme disease, which is just a little bit of information about Lyme. Lyme is transmitted through the bite of an infected tick. So I live in the Northeast. In the Northeast, it's transmitted by a deer tick. In other parts of the country, it can be transmitted by other ticks. The ticks are super teeny tiny. I never saw a tick on me. I never got a rash, the typical, you hear about the bullseye rash. I never got that. A large percentage of people who have Lyme do not get the rash. I did have the typical flu symptoms, but no red flags went up and no one really thought anything of it. And Lyme can cause a huge array of symptoms. It can mimic a huge number of diseases. It is very hard. It can be very hard to diagnose, especially by doctors who don't really know about it. And there is also this huge divide in the medical community. There are doctors who believe that chronic Lyme, which is what I have, does not exist, and that after you have been treated for a month or 2 months with antibiotics, any symptoms that remain after that are autoimmune, are just permanent damage that has been done, and are not active infection and should not be treated with further antibiotics. If I had been treated that way, I don't know where I would be today. It is truly the long-term antibiotics that have given me back my life over these 17 years. Then there are excuse me, then there are the doctors who actually see and treat the patients and know and believe that you have to continue treating actively as long as there's symptoms. And sure, there might be some permanent damage. I am pretty sure that I probably will have some of these symptoms forever and not necessarily need to be on antibiotics forever, but gonna continue to have symptoms. But to just say that, okay, after 2 months you're done and no more antibiotics and you're cured and it's all in your head after that is just so frustrating. So anyway, so there's this huge divide in the medical community, and so when I have been in the hospital in the past with various issues, it has been super frustrating because the majority of the doctors are not understanding, do not believe that my diagnosis is correct and that I should be on what I'm on and all of this stuff. And it is really frustrating, and it has been really hard to deal with those situations. But I have amazing doctors who I see, on a regular basis who treat me actively, and I am super thankful for them. So I am now at this point just rambling on, and I've been rambling on for almost 15 minutes. So I'm gonna end this, and hopefully there is some coherent thoughts in this, and it's not just jibber jabber, and someone will find this interesting and informative. And I do plan to do at least another video kind of chronicling a little bit more of my history, and perhaps a video with a little bit more about the specifics of Lyme and the other tick-borne diseases, if people are interested in more information on that, because I certainly have a lot of experience with it. So anyway, so that is it for today. I'm sorry that it is so long, but hopefully some of you found this interesting and enjoyed watching. So that's it, and I will talk to you soon. All right, bye.